With sleep apnea, and that kind of goes along with snoring, is that a lot of times it's usually the spouse that complains about the other spouse about snoring. And so eventually we will have patients that come in and say, I need to get a snore guard. Is there something you can do about my snoring? And it's nice because there is. I mean, there's different levels of anywhere from someone who snores. It all has to do with constriction of airflow. So someone who has sleep apnea, obviously that's more severe. That constriction, and the constriction can be caused by a couple things. It can just be caused by the position of the jaw. So for whatever reason, some people just have some excess tissue back there. Or it can be caused in severe cases where that tissue actually, for some people, when they go to sleep, it actually relaxes to the point to where now it closes, not because of the jaw position, it just closes. And so sometimes those cases can't be treated with something. They need to be treated with a CPAP or something that's actually forcing oxygen back into the throat, that's forcing that tissue to open. But that's not the majority of them. The majority of them can be treated with a snore guard, and what that does is it slightly takes the lower jaw and moves it forward so that when you're sleeping at night, it doesn't fall back, closing off the opening, causing the constriction, which is going to cause the snoring. And then with sleep apnea, of course, what that is that you're just not getting enough oxygen at night. And so what happens is people will kind of they do snore. People with sleep apnea snore pretty heavily, but they get to that point to where all of a sudden they can't breathe. They're not breathing, and then they wake themselves up because, well, the body forces them to wake up because they're not getting enough oxygen. So, and they're not even aware of the fact that they're waking up. They wake up, everything opens back up, and they fall back asleep. But you can imagine if you're doing that several times a night, you're not getting very good sleep. So the biggest benefit that we've had, and the biggest thing that's been exciting for us, is that when you treat patients with this, the biggest thing is that they just feel better in the morning because they've actually gotten a better sleep. Whether it be because they're getting more oxygen, or whether their spouse isn't hitting them as much, telling them to roll over. But and then, like I said, there's different devices which fits the different needs. There's about 3 different devices that we use. So and we've had really good response with it.